Ya Allah, Subhanallah, Ya Allah, Alhamdulillah, Ya Allah, La ilaha, Allahu Akbar, Ya Allah, Subhanallah, Ya Allah, Alhamdulillah, Ya Allah, La ilaha, Allahu Akbar.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu. You are welcome to another edition of Today's Woman, the African Pride. Today we're going to be talking about palliative care. So naturally it's a health topic, and then I have my health personnel in the studios. We have a familiar face. She's ever so kind to make herself available to educate me and you about whatever we need to talk about in the studios. Here, we are the Wahab Adams Studios of MTA Ghana. And to my far left is Madam Aisha Ajwa Boateng Ahmed. You're welcome to the show. Thank you for coming again. Madam Ajwa Boateng Ahmed, let me take my time with the name, is a Deputy Chief Nursing Officer at the Kolebu Polyclinic and a clinical lead nurse for the palliative care. So we're going to be talking about everything that has to do with palliative care. So you hear me say that a lot. My immediate left is a new face. Her name is Mariam Ibrahim. You're welcome to the show. Madam Mariam Ibrahim has a master's in public health. She has specialty in palliative care. She works with the Mercy Ships. She'll tell you a little about that. And then she is a nursing officer as well. So my guests are very loaded. I'm not here to play at all. We're here to give you all you need in terms of health. You know how Today's Woman comes is for the contemporary African Muslim woman. It's for everybody, but tailored for the contemporary African Muslim woman. So please do not miss Today's Woman. My name is Hiba Farouk, and we're going to go straight to the show. You're welcome once again. All right. So let's just go straight to it as we usually do. What is palliative care? Who's going to take the first one for us?
Yeah,
our guest.
I can go ahead.
Okay,
yeah.
Great.
So palliative care is basically it's an approach to care where we tend to improve the quality of life of patients with life-limiting illnesses, and we do this through impeccable assessment. We just do early identification of symptoms, and then we manage that symptom holistically, both psychologically, spiritually, physically, and emotional. We try to help the patient and their family through any distressing symptoms that they go through.
Okay.
Yes.
This is very interesting. I have some more questions to ask centered on that, but I'll direct that to Madam Aisha. But before we do that, immediately, we made mention of Mercy Ships. So would you like to tell my viewers what Mercy Ships are?
Okay, so I volunteer for Mercy Ship. Currently, I'm on leave of absence from Mercy Ship, but my employers are Kolebu Teaching Hospital. So Mercy Ship is a non-governmental organization. Their headquarters is based in Texas, US, and they are into surgeries, free surgeries. So they travel down the coast of some African countries to do surgeries for those who can't afford to do simple surgery. So they travel and help people. They do clap forward. They do all sorts of life-changing surgeries, and we know in Africa and in some nations around the world, we have people who do not have access to basic surgeries, and so this is what Mercy Ship does.
Okay. Just a quick one. So is it focused on third world countries? Is that it?
Currently, yes, it's Africa.
Amazing.
It's Africa. And I think countries like Benin, they've been through countries like Benin. Recently, we were in Senegal, and we didn't finish the field service because of the COVID. But yeah, so that is how it is.
That's brilliant. Yeah. Okay, I had no idea anything like that existed. So it's really amazing to know that there are people out there that are catering for very dire cases. So moving on to my lead nurse for palliative care. My next question is, who needs palliative care?
Well, as she rightly said, it's for people with life-limiting illnesses. And then we also have people who have symptoms such as pain. excruciating ones that is in excess to the extent that they need help. So we normally take care of people. For instance, our place, we take care of most of our patients are cancer patients, actually. But we do also take care of symptoms such as pain. And you know, pain is very universal. Yeah, a lot of people have pain. So we take care of that one. And then people with symptoms such as maybe constipation, diarrhea, nausea, like they feel like vomiting, you know, and then sometimes too, people have that they cannot sleep, they can't eat. You know, we take care of them. And though they may be very ill, they may have a terminal illness, I would say. We try to make their life very comfortable. So such a people that we take care of.
You mentioning things like diarrhea and other, you know, anything that has to do with pain leads me to my next question. Is it accessible? Who can access, you know, palliative care?
Everybody can access it. When you need palliative care, it can be like self-referral. You can walk straight in to us and then ask for help. Or you can be referred from your primary physician or the doctor who has seen you and they realize that there's some situations that need help from us. They can come in. And then sometimes we get referrals from the wards. So, or hospitals, anybody at all can refer to.
I know you have done, you know, an overview as to what palliative care is, but I'm very curious. Is it an independent, you know, unit? What exactly does it do? How does it operate?
Okay, so picking from what my boss, she is my boss, my boss just said, we are mainly focused on relieving suffering. Patients that are diagnosed with diseases like cancers, they have symptoms that are so bad and they suffer a lot. And so I know she was trying to tailor it away from cancer because most of the time, some medical practitioners think that palliative care is for only cancer patients, but it's not. Any patient that has symptoms that are out of control, that cause suffering, we are there to help. And so, as we said, we do a holistic care. And so that is how we do. And then you can access palliative care in the hospital. So currently, it's a new discipline. So currently in Ghana, we have most of the facilities in the cities like Accra and Kumasi. But other people who have gone through the units, who have trained, are able to practice some form of palliative care. So you can access it. In Kolebu, you can access it. There are other places that you can go to get palliative care also.
Madam Aisha, how is this care delivered? What's the administration like? How is it? I'm very curious because, and I like that it was mentioned that it's new, because I started to wonder, has this always been in the system? How is it? Tell me.
Well, for us, we've been in the system as working clinically for the past 9 years, right? So for our unit, for instance, we work in Kolebu Polyclinic. We call it Family Medicine Department. We see patients mostly on OPD basis. We don't have a unit per se in Kolebu, though we have some kind of units in Tetekwashi Memorial Hospital. It's a 9-bed unit for only palliative care. So we get a referral. And let's say the person has cancer and the person has been going for treatment at the oncology department and have been through the system. And it gets to the point that they feel that the patient is weak, maybe cannot continue with the chemotherapy or radiotherapy, and they will let them come, even though we're supposed to have such patients from the beginning of their diagnosis. That is how we're supposed to practice. But in here, we have a little bit of challenge in that aspect, that they think that when the person is getting to the end of life, that's when they should bring the person to palliative. So when they come, we do our symptom assessment. We ask them a lot of questions about their symptoms, what they are facing. Then we also treat them accordingly. So we always need to get a lot of information. So our clinic takes the list will be about 2 hours. Sometimes one patient can take us the whole day because we need to treat so many symptoms. And then, as she said, that spiritually, psychologically, physically, and all those things. We need to take care of the physical aspect. We need to take care of the psychological issues, the spirituality, and then the cultural aspect too is another issue altogether. Then the ethical one. We all have ethics, so we need to make sure that they are seen and then seen well.
Wow. So this is like it's an entire package.
Yes.
So I assume there's some sort of therapy that comes with it. There's some sort of... I want to go further, right?
Yes, no, we have all the time for you. We are here.
Okay.
Because we do a lot of, asking a lot of, we go deep with our clients.
Right. Okay. So then you do your main aim is to relieve pain, to bring comfort to whoever is going through a long-term sickness, that has a lot of pain.
Well, not only pain per se. A lot of suffering. Yeah, use the word suffering.
Right.
Because it may be constipation that is chronic and it's not going. It causes a lot of suffering.
Okay.
So pain is one aspect of it.
Oh, okay. Yes. Okay, so then it's not limited, like you said, it's not limited to terminal diseases, just anybody that is going through any sort of suffering.
Yes, life-limiting illnesses.
Right.
Like end-stage renal diseases, chronic pain out of control, any chronic issue that is making the patient suffer.
Okay.
Our doors are opened.
And on the field, what are some of the top 3 or top 4 in Ghana or in Accra that keeps coming in, that keeps repeating itself on the field? What's
with regards to the conditions?
Yeah, the conditions that come.
Okay, so currently with our patients, we have over 99% of them are cancer patients. Yes, 99% of them are cancer patients. We also have patients coming in with chronic pain, out of controlled pain. And some people also come in with symptoms that are very difficult to manage. And so once we come in, we do that. And so as I would add up to what I would keep on saying my boss said.
Our boss?
Yeah, she's my boss and my mom at the same time. So what we normally do is when you come, we have different domains that we work in. Okay. So our main aim is to explore and figure out exactly what is wrong with the patient. And so we do explore your problems, and we have other tools that guide us to do that.
Right.
And then we also help you to set goals of your care. And so for us, we work with you and set your goal. It's not like you come to the hospital and then we tell you what to do.
Right.
But we set the goals with you,
right,
and we plan your care with you.
Right.
Another thing that we do is also we do coordination of care. We coordinate patient care. Sometimes patient comes to you, has been to different physicians to see different medical physicians, and then we try to coordinate your care so that we at least make you comfortable. So as I said, 99% of our patients are cancer patients. And unfortunately, by the time they get to our end, they have actually roamed all over and they've gone through a whole... So you could see that this patient is having a lot of suffering, not only physically, but psychologically. They are tired. And so they need this sort of coordination. And so we try as much as possible to coordinate our care. We planned their care ahead, advanced planning. What would happen ahead of time? What are you going to do with this current situation? And so that's what our aim is actually towards. And we try as much as possible to help these patients through it. Yeah.
So let me add.
Yeah, sure.
So apart from the patients, we add the family too. So they become a unit.
That's amazing.
Yeah, because some of them, the family also may have a problem.
Right.
So we try to also help with whatever situation they are also in.
Yeah. I think we like to talk about this part because it's a very sensitive part.
Yeah, I was going to ask about it, but sure, roll on.
So when the patient is sick, when someone is sick, the whole family is affected. And so if you have an idea of what I'm talking about, you take your patient to, for instance, and I'll use Kolebu because that's where I work. The patient will go to this doctor and go buy medication. The healthcare giver will have to do the running around. Sometimes we turn our healthcare givers to to pseudo nurses, and they do most of the jobs for us. And so most of the time, the family is stressed. Patient is sick. Family is stressed. There are other problems that are pertaining to the care, and so we take care of the patient, inclusive of the family. And so once we know that the family is well taken care of, then we know that that stress is also taking off the patient and the patient's quality of life. So the underlying word is improved quality of life, regardless of the patient's condition.
Right. In terms of family, it's very notable that the family is affected financially, emotionally drained, etc. In terms of terminal diseases, say cancer, that there has been a time, frame on the person, unfortunately, the person's life. Is there a sort of counseling you do to prepare the entire family for what they're about to face or what is coming? Is there something like that?
Yeah, we actually, so when we talk about a holistic, someone would ask a question, how can you do all this? Like if you're a nurse in the unit, how can you do all this? So palliative care involve interdisciplinary team. Where we have doctors, we have clinical psychologists, we have the social workers, we have the pharmacists, we even have chaplains. Chaplains who can play a role as a Muslim. If a Muslim comes in, can play the role for the Muslim, can play the role for the other religions also involved. We also have other, like in some settings, we have aromatherapists, we have physiotherapists. Yeah, we have other people that come together.
Some even use the animal therapy,
the pet therapies. Yeah, depending on the country.
The therapy dogs or cats.
Yes, exactly. And so all these, mind you, the word is a holistic care. So we want to use a holistic approach. So when we assess a patient, so as you said, if a patient is having days to, so we normally don't say patient have 20 days. We don't go straight to make prognosis. But if you have a patient who has a disease that is likely to take them away, then we have a way of going about it, depending on what exactly is going on. If there is a psychological aspect, then the psychologist on the team could handle it. But we, the team members, like the nurses and the doctors, we have some specific training that puts us in a position to support our patients when they are going through this. And so we support the patient and the family. It's not an easy journey, especially for the end-of-life patients. And so they need constant support, constant counseling, and trying to take them through, making them understand that it's not an easy journey, but you are there with them.
Okay, so it seems very vast, a department. It seems like because I do know that there are entire departments dedicated to psychological needs, and because I'm hearing aromatherapy, that's very detailed. So at this point, does somebody walk in with mental illness? That is just the only, or does it have to be related to a certain kind of pain? And that is when you guys come in.
Okay.
Do you want to help? Let's try it. For the mental illness, they have a specific place that they do go. But, we have mental illness that's related to our cancer situation. So when that happens, then we take care of that. But if we think that it's above, that's why it's interdisciplinary. We can let you see the psychologist, but we also have a way of treating. So because some of them, it's because of the disease condition. That's why maybe you become aggressive, delirious or something. We have things that we can do to help so that you go through it peacefully.
So in as much as it is very, diverse, it's not on its own. Like those sections are not on its own to treat somebody directly.
The kind of patients that we see. So as I said, the emphasis is on the holistic care. These patients come with a condition that have diverse problems, and another key word in it is improving quality of life. For instance, assuming you are not sick, if you want to have your quality of life improved, there are a whole aspect of things that can improve your quality of life. And so everybody everybody, whether you have a life-limiting illness or not, you are entitled to having good quality of life. And we have a certain standard for quality of life that sometimes these patients don't have. And so our main aim is to target that. That is why we have this interdisciplinary team. And it's actually palliative care is actually an aspect of medicine. Like we have neuroscience, we have oncology. It's actually an aspect of medicine. And we have people, consultants who are palliative care consultants. They do specialty basically to do palliative care. Yeah.
So it's like the coordination, for instance. You know, we do also have the surgeons who are also into palliative. So like if you have a patient that have ear, nose, and throat condition, especially maybe whatever it has affected the voice box, we can get somebody, we coordinate, as Mariam said, we coordinate. So we can coordinate with the surgeons for them to do, or the ENT specialists to do, to put a tube here for the person to be able to breathe well and whatever it is. Or if the person cannot, let's say poo-poo, we can get a bag. They can just open up a place for the person. Or if it's throat problem and the person cannot eat, we can also put a bag there where we can feed through. So we do all these coordinations for them to get that holistic care and then give them the quality of life. Because if your throat is not functioning, you cannot eat, does not mean that you shouldn't leave. So we have to make you very, very comfortable. And so that coordination goes all around. Any diverse condition that comes in, we try to sort it out for us to have quality of life.
We're still in a pandemic. We're going to, unfortunately, we don't have time on our side. So we're going to do a part 2 of this particular topic, and we're going to delve into other matters of it. But before we do that, this is today's women related. I am aware that there are certain processes of childbirth or childbirth aftermath that becomes very, severe. It's unpleasant. Does palliative care cater for those, like postnatal, am I correct? Postnatal, complications or issues. Does palliative care come in that aspect as well?
So as I mentioned earlier on, it's actually an approach. So the midwife can use the approach. The surgeon can use the approach. We actually have levels that we practice it. And so if you are in a primary level where you just do other stuff, you can use that as because it's a very good approach. Imagining taking care of your patient holistically, trying to explore the patient's problem and trying to improve your patient's quality of life. If you had malaria and you go to the hospital and your doctor does this for you, you feel like, oh, yes, I've had a very, the person might not really delve into the technical issues that are involved, but would have used some aspect of palliative care. So as I said, it's an approach. So if a patient, a mother has a after birth complication, how it's being handled the approach can be used. Unless probably there is an aspect to it that is going to be part of the patient's life chronically that the patient needs to know how to live with. And you think that patient needs a specialist view on that, you can refer that patient to palliative care for us to handle. So we are trying to move away from the aspect where a patient comes to us and you cannot do anything kind of thing. That's why we really don't want to mention it. We don't use that word because, again, our aim is to relieve suffering. So whatever suffering that the patient is going through, if you think that you cannot handle it at your level and you want a palliative care specialist to come in, we are open to also help you.
Brilliant. It has been amazing. I've learned so much. I had no idea this was even a discipline of medicine. I've been speaking to Madam Aisha Ajua Boateng Ahmed and Mariam Ibrahim. They're very heavy and essential health workers. I'm so grateful to have them in the studios with me. If you're watching this and you feel unsatisfied, you have so many questions like I do, please look forward to our part 2 of palliative care. We're going to delve into how palliative care plays an essential role in the COVID-19 pandemic. We've been in the Wahab Adams studios of MTA Ghana. This has been Today's Woman, the African Pride. My name is Hiba Farouk. Assalamu alaikum rahmatullahi ta'ala wa barakatuh.
And there is no God beside him, the knower of the unseen and the seen. He is the gracious and the merciful God. Oh Allah, you are most great. He is Allah, and there is no God beside him, the knower of the unseen and the seen. He is the gracious and the merciful God. Oh Allah, you are most great. Oh Allah, you are holy. Oh Allah, we praise you. Oh Allah, there is no God, you are most great. Oh Allah.